I'm gonna be leaving for the night.
Oh, okay.
Yes, but Brittany's amazing and she's taking over.
Hi.
So
How
she'll
are
be
you?
your
I'm
nurse.
okay.
Okay, so Pam Johnson, she's a 30-year-old female. She just came in not too long ago at 1300.
All right.
She's a full code.
Okay.
She has a wound on her left forearm.
Yep.
Okay. Immediate concerns right now would be knowledge deficit pertaining to her diabetes type 2 diagnosis.
Okay.
She's had diabetes for about 4 years.
That's
Okay.
correct.
Okay. So past medical history, she has a diabetes type 2. She also has hypertension.
All right.
She hasn't had any surgeries, no known allergies. Her attending is Marissa Pelletier. She arrived at about 1 o'clock
Okay.
and she complained of pain at the wound site.
All right.
We took her vitals at 1320. Her blood pressure was 150 over 95.
Yep.
Her heart rate was 110. Her respirations were 18. Her temp was 98.9. She was at a pain level of 6.
All right.
Her O2 was 98% on room air.
Okay.
We did do a glucose test. It came back at 330,
Okay.
330. So we gave her 8 units of Lispro.
Okay.
Okay, and labs have been taken.
All right.
So definitely follow up and recheck her sugar.
All right.
Caitlin Hammond, she's our diabetic educator. She's
Yeah.
actually going to be coming up this afternoon to do some teaching.
Awesome.
We want to make sure that we're maintaining her comfort, controlling that pain.
Yeah.
Call the lab for the results.
Yeah.
And we'll have to culture her wound and do a wound assessment. Like she
Alright.
literally just
And
came
have
off.
you sent a recommendation to get the wound care nurse to come up here as well?
Yes, yes. So the wound care nurse is actually going to be the one doing the culture.
Awesome. Okay.
Okay.
Great. Awesome.
All right.
All right. Well, thanks so much. Have a great night.
Welcome. You too. Take care.
Bye.
Get better.
All right, Pam. How are we today?
I'm okay, I'm a little hungry.
All right, I'm just gonna wash my hands, put on a pair of clean gloves, and then do you mind if I just take a look at your wound?
Yeah, sure, it's right here.
All right, and then I'm just gonna have my CNA Justin come in and take another set of vitals on you and another glucose test, just to make sure that the insulin that we gave you helped us out, okay?
Okay, that sounds great.
All right. So when did this wound pop up?
Happened 2 weeks ago.
Alrighty. And ever since then, it's just been open to air?
Uh-huh.
Alright.
I've been washing it with soap.
Okay. Alright. So it seems like it's warm to the touch.
Yeah, it's a little painful when you touch it.
Okay. And then it's it's right around the outside. We have a little bit of granulation tissue, which would show that the wound is starting to heal, but we would definitely like to see a little bit more of that.
Okay.
But there's nothing draining from it. It's not malodorous. So what I'm gonna have the wound care nurse do is come culture it to make sure that there's nothing growing within it. And then she's gonna show you how to take care of it in terms of wrapping it and how often you should do that and how you should do it.
Okay, that sounds good.
Do you mind just telling me a little bit about your lifestyle? So what does your diet look like?
I really like to drink my Mountain Dew, and I really like my chips,
All right.
and I eat a lot of potatoes.
Okay. Do you get a lot of exercise?
No.
Okay. And are you a smoker currently?
Oh yeah.
How much?
Like 2 packs a day?
Okay. And alcohol use?
Maybe 2 glasses of wine a night, maybe, if I'm having a good day.
Okay. And any drug use at all?
No.
Alright, that's good. Justin, still in the middle of taking those vitals?
Yes.
Okay. I'll help you out here. Can I just see your finger really quick?
Sure.
Okay.
Under the timer?
Alright. So like I said, going forward, as well as having the wound care nurse in here, we're gonna have our diabetes educator come in. She's gonna teach you just a little bit more about your, how to care for your diabetes, making sure that your sugars are where they're supposed to be.
Okay.
Alrighty, and then I'll come back with her, once I get the results also from the wound care nurse and what the culture comes back as.
Okay.
Alright, Justin, do you have those,
Yes,
vitals for
I'm
me?
just grabbing that blood glucose for you.
Alright. And you have a glucometer at home, right? That you're taking your blood sugars with regularly?
It broke
It
a couple
broke.
of weeks ago. So
Oh, okay. So have
I've
you just been giving insulin?
I've just been winging it and seeing what happens.
Okay, great.
Ow.
I'm sorry.
That's okay.
298 on that blood sugar.
Alright, so it looks like the insulin is working, it's starting to go down, okay? That's good.
Okay.
She's 148 over 90, her
Okay.
pulse is 100,
Okay.
and her temperature is 98.6.
Alright, and the pulse ox is 98% on room air, which is good. All right. So I'm gonna go ahead and send Patricia in unless you have any last minute questions for me while I head out, and then I'm just gonna go check a few patients and I'll be back.
Okay.
All right.
I might think of something later.
Okay. Hi, Sam. I'm Patricia. I'm the wound care nurse.
Hi, nice to meet you.
Hi, I'm gonna be taking a culture of your wound.
Okay.
I want to measure the wound.
So it's 4 inches long and half an inch wide. And now I'm just gonna clean it up and put this bandage on top. So, have you been taking care of this at home at all?
I've just been washing it in the shower whenever I take a shower.
Oh, and you haven't been covering it?
No,
We should
I
be,
didn't think I needed to.
you should be covering it and changing the bandage twice a day.
Okay. Okay, that feels
Okay.
comfy.
Good. Okay, so I think, the diabetic teacher's gonna be coming in shortly to come speak with you.
Okay, sounds great.
All right, Pam, that looks great.
Right?
So she taught you how to take care of that wound?
Mm-hmm, I should cover it up.
All right, so I did get the results back of the culture, and there's nothing going on in the wound right now, but I spoke with your provider, and she just wants to make sure that we put you on antibiotics, just to make sure that nothing does happen with this wound and that it gets better and doesn't get worse.
Okay.
Okay, so she's decided to put you on Cephalexin 2 times a day, 500 milligrams. You have no known allergies, right?
No.
All right, so just something to keep in mind with the medication, if you start to feel nausea, if you're vomiting, if you have diarrhea, stomach pain, if you get rashy at all, headaches, or you have trouble breathing, make sure that you stop taking the medication and call us.
Okay.
That can be a reaction to the medication. And then also, as you're changing this, if you start to see that it's draining, that it smells, that it seems more red than normal, to make sure that you give us a call. And then I'm gonna need you to take your temp at home. Try and take it once a day. If you start to feel warm, you can take it again. Anytime it's greater than 101, you definitely wanna come back in and see us, okay?
Okay, I can do that.
Yeah. All right, so I'm gonna have Caitlin just give you a little bit of teaching about, diabetic diet and your insulin, okay?
So I heard that you lost your glucometer.
Yes, I did.
Okay, so I have here a new
Oh,
one for you.
fantastic.
Is this the one that you had?
Yes, it looks
Yes.
familiar.
Perfect, so you know how to use all this stuff and
Yep.
take your blood sugar on your finger. Good, okay, I'm gonna bring that for you to bring home. This is your little case. Okay, so here I have a diabetic diet information, some foods that are in there that you can eat and,
Ooh, I don't like this list very much.
I know, but unfortunately, that's what's gonna help you heal and control your diabetes, and controlling your blood sugar is gonna help heal your wound.
Okay,
So you don't exercise at all, so
No.
we would like to see you exercise at least 3 times a week.
I'll try my best.
Okay, and then you wanna, eat foods like broccoli, almonds, avocado,
Okay.
eggs. You wanna have healthy fats, protein, be consistent with your meals and the times that you have your meals. That will help a lot as well.
Okay,
So you wanna have about 15 to 20% of your daily intake to be protein, 45% to be carbs. And do you know what type of insulin that you're taking right now?
I'm taking Lispro and Lantus.
Okay, so do you know how to inject that? You've done
Yeah,
that before,
I've
you're used
just
to
been
that?
giving it whenever though, because I don't really know
Okay,
my
well,
blood
we
sugar.
wanna take Lantus 1 time a day.
Okay,
And you wanna make sure that you don't mix the Lantus with your Lispro.
okay, I've been doing that.
You've been doing that, yeah, we wanna stop that.
Okay,
Lispro is 4 times a day, and with your meals and nightly.
Okay,
But the thing with the Spro is you don't wanna take it if you're not gonna eat within 15 minutes to a half hour.
okay.
Cause
that's
it
fine.
works fast, so your blood sugar will drop rapidly. So you wanna make sure that if you don't have food ready, that you wanna, be aware of that, so.
Okay.
Is there any other questions that you have?
I think I'm good.
Alright,
Okay,
Thank
thanks.
you.
Thanks for this list.
So we wanna see you back here in 2 weeks to make sure that everything's going okay with the wound.
Okay.
Alrighty, so I'll go ahead and, give you a little write-up of all of this stuff, okay?
Okay.
Just so that you have it. Do you have any last minute questions?
Nope, I'm good.
You're good?
I'm gonna try and exercise.
Alright, well, glad to hear it. Hopefully we won't see you back here other than in 2 weeks.
Okay, sounds good.
Alright.
I'll take this. This is for me.
Knock knock.
Hi.
Hello there, Pam.
How are you?
Good, how are you?
Could be better.
My name's Jenna, this is Caroline. We're gonna be taking care of you today. Hi,
Hey.
Can I just have your full name and date of birth?
Pamela Josiah, 224XX.
Okay, what's going on today? We're just gonna grab some vital signs, okay?
I just don't feel right. Something's wrong, but I don't know what it is.
Okay. I see that you have a wound here. What's that from?
My cat scratched me. I went and got it checked out, but they said it was okay.
Okay, did they send you home with any teaching? Did you?
They told me I needed to change the dressing, but I don't have a lot of money. I can't afford all that stuff.
Okay, alright. So I'm just gonna measure it, okay? Caroline's gonna take your blood pressure. You can rest it down right here.
It hurts a little.
I bet, it's a little red around the outside. So the wound is 5 inches long, 3 inches wide, and I'm just going to measure the depth of it. So I'm just gonna stick this in, okay?
It's a little tender.
Okay, so let's measure that. So the depth is about 1/4 inch deep. It is red around the outside. She does have +1 pinning edema. It is malodorous, and she does have purulent drainage. Do you have any pain right now, Pam?
Yeah, it
Okay.
hurts when you touch it and just in general.
Okay. Alright, so I'm just gonna put this on your finger and put you on the telemetry monitor, okay?
What was Pam's pain? Is it
8 out of 10.
perfect?
And is it throbbing, shooting?
Oh,
Does it come and go, or is it constant?
it's constant. I would say throbbing.
Okay. Just gonna get a quick temp underneath that tongue, okay? Ting, ting, ting. Ooh, you got a little bit of a temperature going.
Yeah.
So our vital signs are 102.2 temperature, heart rate is 115, blood pressure is 98/58, her pulse ox is 93, her respirations are 24. So we're just gonna put you on 2 liters of nasal cannula, okay?
I do have a little bit of a hard time breathing right now.
Okay, so that should help you. So while Caroline's doing that, I'm just gonna listen to you, okay? Listen to those lungs. Deep breaths. Perfect. And again. One more time. And I'm just gonna sit you back. Have you had any bowel movements lately?
No.
Nope, you can lay back.
Okay.
Yeah, we're just gonna assess your abdominal.
Oh, it's been a while. I haven't been keeping track of it,
Okay,
but I feel a little bit of discomfort.
okay,
in
so
this
you are
area.
a little distended, so I'm just gonna listen, okay? Right in that right lower quadrant. So I don't hear any vowel sounds, so I'm gonna listen for 5 minutes in each quadrant. 5 minutes. 5 minutes. 5 minutes. 5 minutes. Okay, Pam.
Does this hurt at all?
Don't push too hard.
Okay, what about here?
Same,
Here?
same,
And here?
it's the same.
Okay. Alright, so we're just gonna sit you up, we're gonna listen to those lungs in the back, and I'm gonna just remove this blanket from you, okay? Just because you are a little warm. You wanna get that fever down. Alright, so we're just gonna sit you up, okay? Just so I can listen to you on the back. Deep breaths for me. One more on this side. Alright, now the other side. And one on the side. Okay, Pam, you can sit on back. Alright, so we're gonna go call the doctor. Justin's gonna come in, Rhonda's gonna come in and get some blood work. Justin's out today.
Oh, okay.
Rhonda's gonna come and get some blood work. He's gonna get some blood cultures in each arm, and then he's gonna culture your wound. So he's just gonna take a swab and go on the inside, okay?
Is it gonna hurt?
It should not hurt, okay?
Okay.
So hang tight for me. We're gonna go call the doctor.
Hello, hello. How are we doing in here today?
I'm fantastic.
It's nice to meet you. My name's Rhonda, the phlebotomist.
What do
Just
you
gonna
do?
wash my hands because I just had my break.
Okay.
I'll put on a pair of gloves.
What are you gonna do?
I'm just gonna take some blood to be sent down to the lab,
Okay.
if you don't mind.
Can you be gentle?
I'm always gentle, honey. All right. Let me borrow that first arm here.
Do you smoke?
I do.
Could you give me a cigarette?
I can't. I only have 26 left for my shift. I'm sorry.
It was worth a shot. They don't want me smoking here.
No, it's no good for you. Trust Rhonda, she knows. All right, I'm just gonna take my first blood sample from your left arm. Beautiful. Beautiful.
Oh God, you're so gentle.
I've been told. So where are you from?
I'm from Woonsocket.
Oh, me too. The land of the free.
That's why you look familiar. Are we neighbors?
Everyone's a neighbor in Woonsocket, honey. All right, so I'm gonna go send these right down to the lab, and your doctors will be right back in.
That sounds good. Thank you, Rhonda. Come visit me.
Hi Pam, how was that?
She's wonderful.
Okay, so the doctor's coming in any second. I'm gonna talk to her.
Paging Dr. Finkel. Paging Dr.
Sorry.
Finkel.
Hi,
Hi
I'm
there.
Melissa. I'm Pam's doctor. How are you doing today, Pam?
I'm glad to see you.
How are you doing?
I feel okay. Could be better. Do you have anything to give me?
Yeah, we're gonna talk about that in just a few moments, okay?
Okay. So Pam is a 30-year-old female who is presenting with a wound on her left forearm, who Justin's gonna come culture. Justin's not here today. Rhonda's gonna come back and culture Pam's wound. So she has a wound on her left forearm. She states she was seen at a local wound care center last week and was not compliant with her discharge instructions. She didn't have enough things to change her dressing.
I tried my best.
It's okay, Pam. My immediate concerns are her vital signs. She's febrile, she's 102.2, heart rate's 115, blood pressure is 90/58. Her pulse ox is 93 on room air, so we put her on 2 liters of nasal cannula. And her respirations were 24. Her pain is an 8 out of 10. It's a throbbing pain, and which we think is indicative of septic shock. Her background: she's diabetic type 2. She is a smoker of 2 packs a day. She has no allergies. Significant meds are her insulin that she takes at home, her Lantus or the Lispro, Her friend has brought her into the ED because she's not feeling herself after non-compliance after the wound care visit. Assessment, her vital signs as stated before, her wound is 5 inches long, 3 inches wide, and 1/4 of an inch deep. The wound is malodorous with perilymph drainage. There's no granulation tissue noted. She does have +1 pitting edema around the wound, and she said it is painful. She is on the cardiac monitor, normal sinus rhythm and rate. Pulses are palpable throughout. She does have absent bowel sounds in all 4 quadrants, with some distensions. Her respiratory clear to auscultation, and labs were collected. I'm just waiting for them to come back. So Rhonda's gonna come give me those results.
Hello.
Here's Rhonda.
I heard someone say my name. I've got some lab results for your patient here.
Okay.
All right,
let's
here you
hear
go.
'em. Thank you.
You're welcome.
So her LDL is 190, HDL is 300, lipase is 200, her A1C is 9.5, her glucose is 330, triglycerides 195, white blood cells 20,000, our lactic acid is 4, and we're just waiting for the wound culture to come up and be cultured. And then we will get those results to you. Patient does state she does not feel herself, and at times she is confused. So my recommendation would be a broad spectrum antibiotics until we get that wound cultured and resulted. A cooling blanket for her temperature, and continued monitoring, and consult with the wound care nurse to come up after it's cultured to be packed and properly covered, and PO Tylenol for her temperature.
Okay. All right, I'm gonna do a quick little mini assessment talk with the patient and I'll
Okay.
let you know what I
All right.
should do.
I'm just gonna go grab Rhonda to come culture that, okay?
And then after her culture's done, we should probably set up an IV going in for her. I'm
Okay.
thinking I'm gonna
Coming
probably
through,
give her
coming
broad
through.
spectrum antibiotics right now.
Okay. You're gonna, just put the order in the
Yeah,
computer? Okay,
yeah.
perfect.
Okay, Pam,
What's wrong with me?
we're gonna find out.
Okay.
So right now, I believe you're probably I believe you are on the parameters of septic shock. Just wanna take a quick.
I feel shocked.
Alright, and you have a fever. So, Jenna, I think we're gonna give her some acetaminophen probably for her fever. If it goes up past 101, give me a call. We're gonna give her 650 milligrams of acetaminophen every
Right, honey.
4 hours.
Okay.
How you doing?
Okay, well, shocked.
I wanna give her some IV vancomycin, 500 milligrams every 6 hours, and I'm gonna put in an order for a cooling blanket
Gonna
as well
culture
for
this
that
wound
fever.
here.
Okay.
So
Ew.
Pam,
Looks kinda nasty, doesn't it?
It does.
we're gonna give you some vancomycin for your wound. It's
What
an
is that?
antibiotic.
Okay.
So I just want you to know some of the side effects, okay? There's anaphylaxis, which is a severe allergy. So if anything happens, we'll be right here. We're gonna make sure that you're okay.
Alright.
There's wheezing, you have rashes, hives, itching, dizziness, nausea, vomiting, red band syndrome, and this is when the IV gets put in too fast. Your whole body will turn red. Don't worry.
Take it slow
We're
with
gonna
me,
go very
please.
slow. There's some great nurses working here with you.
Okay.
And then I just want you to report if you feel any vertigo, which is like a loss of balance, any hearing loss, having trouble hearing at all, you just let us know, or tinnitus, okay?
Okay.
Alright, and I'll be
I
back.
already have tinnitus. Just tell her.
Alright. I'll be back to check on you shortly, and Jenna and Caroline will be taking great care of you, okay?
Okay.
Alright,
Okay,
so I'm
thank
just gonna
you.
put in those orders, have you guys, sorry, thank you.
Thank
Okay.
you.
Poke me again?
We're just gonna put in an IV so we can get that vancomycin running, okay?
Okay.
I'm gonna go grab your PO Tylenol, okay?
Sounds good.
I'm gonna check to make sure the order's in the computer.
We're gonna
okay?
double check the orders before we start that, okay?
Rhonda's going on break, guys.
Bye, Rhonda.
Bye, Rhonda. Smoke a few cigs for me?
Okay, so we'll just start this IV up.
Oh, hold on, let me get, I'm so discombobulated.
The order was confirmed. Okay, so I'm just gonna have you stay nice and still. We're gonna tie that tourniquet on. We're gonna put in the IV. Little pinch. Okay.
It's so gentle.
You'll feel okay?
Mm,
Alright.
Do you have any allergies?
no.
Okay, and full name and date of birth for us before we start giving you your medications.
Pamela Josian.
Okay.
24th, XX.
Okay. So we're just gonna check that with the order at the bedside.
I have 500 milligrams vancomycin.
Okay, yep. Date of birth is correct, name is the correct route, we're doing it cleaner. Okay.
Who brought me here?
Your friend did, cause you're a little confused.
Okay.
So we're just gonna scrub our hub and administer the vancomycin. I'll grab you your acetaminophen.
Who has my car?
We'll worry about that in a little bit, Pam, okay?
Okay, alright.
Alright,
Rhonda's gonna take me home though.
we'll see about that.
I'm on my clamping.
Okay, Pam, I have your Tylenol, okay? Double check the order. 650 milligrams, date of birth for me,
May 24th, 19XX.
and full name.
Pamela Josian.
Okay, so I have a glass of water here. You're gonna take this acetaminophen, okay? Make sure that went down. Here's some water.
Thank you, I
Okay.
needed that.
Alright, we'll check on you in a little bit, okay?
Sounds good.
Hi Pam, just me and Caroline again. We're coming back to reassess your pain, okay? And the doctor's putting in an order for some Lispro since your sugar was 330, okay?
Okay.
So how's your pain now?
I would say it's like a 4 out of 10.
Okay.
Going down.
Okay, that's
A
good.
little more bearable.
Alright, perfect. So I'm just gonna check your pulse ox again, since you are on that nasal cannula. So it is come up to 95%. So we're just gonna go check the orders and we'll be back with your Lispro, okay?
That sounds great.
Alright, you okay?
Yep, I
Alright.
believe so.
I'll take
Okay.
another set of vitals,
Okay.
okay?
Sometimes you wanna go where everybody knows your name, and they're always glad you came. You wanna be where you can see our troubles are all the same. You wanna be where everybody knows your name. Roll out of bed, Mr. Coffee's dead. The morning's looking bright. And your shrink ran off to Europe and didn't even write. And your husband wants to be a girl